When I left my six-figure Wall Street job, my father didn't speak to me for 8 months. At Thanksgiving, he toasted, "Real men who don't quit when life gets hard." I smiled and said nothing. 2 years later, I watched him freeze mid-sentence when his cardiologist casually mentioned an app that helped diagnose his rare heart condition. My application: subscribe for more real stories that hit deep and stay with you. My name's Ethan Markham, I'm 34, and I live in Brooklyn, New York. I used to be an investment banker with one of the biggest firms on Wall Street. The stress nearly destroyed me. Insomnia, panic attacks, a sense of meaninglessness I couldn't shake. I walked away at 31. Now I'm the founder of a low-key digital health platform called PulseAware. It uses AI and wearable data to detect early signs of cardiovascular distress, especially in underserved communities. No fame, no spotlight. But it matters. The day I told my dad I was leaving finance, he stared at me like I'd grown horns. "You don't quit a job like that," he said. "You retire from it after you've made something of yourself." He was already halfway into a scotch, but his words sliced clean. I tried to explain about the chest tightness, the ER visits, the nights I stared at the ceiling thinking, "Is this it?" He waved it off like I was being dramatic. "You think I loved going into the Navy every morning? You do what you're supposed to. That's how we survive." My mom looked down at her plate. She didn't say anything, just quietly reached for the mashed potatoes. I packed up my apartment in Midtown and moved into a small walk-up in Brooklyn. No elevator, no doorman. I sold my Rolex to cover rent for a few months. Every weekend, my father sent me job listings, from hedge funds, private equity, anything with a title that screamed important. I stopped responding after the 4th one. He stopped calling after the 6th. I started building PulseAware on a $300 refurbished laptop in a coffee shop that smelled like burnt beans and ambition. The idea came from my own medical spiral. I realized how many warning signs I'd ignored, signs I didn't even know were signs. What if wearable tech could translate that noise into something clear? Something life-saving? I taught myself enough Python to build a prototype. I spent nights combing through medical journals, emailing strangers on Reddit for help, and cold DMing cardiologists on LinkedIn. Most never responded. Some did. Quietly, kindly. The early app was ugly, but it worked. It could flag irregularities, heart rate variability, sleep patterns, minor arrhythmias, before things got serious. I tested it on myself. Then on my friend Luis, a firefighter with 2 kids and a borderline blood pressure problem. One night the app pinged him at 3 a.m. His heart rate was spiking abnormally in his sleep. He went to urgent care the next morning. They found a blocked artery. The doctor told him, "You're lucky someone caught this early." He looked at me like I was a different person. That night, I cried in the shower. Not from stress, from finally doing something that mattered. 3 months later, I got invited to my cousin's engagement party. Big backyard event. Catered. My dad was there, gripping his whiskey like it kept him tethered to the earth. "Still on your little tech project?" he asked, loud enough for the table to hear. I smiled. "Yeah, we're in beta testing now." He chuckled, looked at my uncle. "Ethan gave up Wall Street to be a coder." The table laughed. Not cruelly, just dismissively, like I'd said I was chasing UFOs. My mom brought out pie to break the tension. "Sweetheart, have you thought about going back into finance? Just until this little thing settles?" My stomach dropped. That night, I sat in my car outside their house, gripping the steering wheel until my knuckles went white. It wasn't that they didn't believe in me. It was that they never even looked closely enough to try. Back home, I opened my laptop. One new email. Subject line: Interested in partnership. Dr. Karen Fields, Mount Sinai Cardiology. I stared at it for 5 full minutes before clicking. Dr. Karen Fields wasn't just a cardiologist. She was the cardiologist. Published in The Lancet, keynote speaker at international conferences, head of tech integration at Mount Sinai. Her email was brief but electrifying. Saw a patient whose wearable flagged an issue. Turns out it was your app. Let's talk. I think this could be big. We met in a hospital conference room that smelled like lemon cleaner and fluorescent stress. I wore my only blazer, creased from hanging behind my door for too long. She didn't ask for a pitch. She already knew what the app could do. What you've built, this isn't just tech. This is intervention, preventative medicine with teeth. She proposed a pilot study. Real users, real data through Mount. Sinai's digital health incubator. I need your app ready for clinical review in 8 weeks. Can you do that? I nodded before I thought it through. On the subway ride home, I nearly threw up from nerves. But somewhere between Atlantic Avenue and Delancey, a quiet realization hit. My app wasn't a little thing. Not anymore. The next 2 months were brutal. I worked 16-hour days out of my apartment, surrounded by coffee cups, whiteboards, and sticky notes stuck to my fridge like prayers. I hired a freelance developer and a UX designer, paid them with what was left of my savings and a cut of future equity. We ironed out bugs, refined the UI, and ran mock user tests with volunteers from a Brooklyn community clinic. Meanwhile, my dad still thought I was between jobs. At a family dinner, my cousin's fiancé asked how I was doing. My dad cut in. Ethan's still finding himself. Everyone chuckled politely. I just kept eating. But the next morning I got a call. Your platform passed the review board, Dr. Fields said. We're greenlit. You'll be part of the Mount Sinai Digital Cardio program this fall. I didn't tell anyone. Not yet. Not because I wasn't proud, but because the win felt mine. Unshiny, quiet, and sacred. Sometimes, the best revenge isn't proving them wrong. It's building something so solid you don't need to explain anymore. A few months into the pilot, PulseAware was rolled out to 500 patients across Mount. Sinai's system. I didn't know any of them. That was the point. It was about scale, not ego. Then, on a random Tuesday, my mom called me. Panicked. Your father's in the hospital, chest pain. They're running tests. I dropped everything and rushed to Mount Sinai. When I got there, he was already stabilized, thank God. A mild cardiac episode. Manageable, but a wake-up call. When his cardiologist walked in, I froze. Dr. Fields. She didn't recognize me at first. She flipped through his chart. Good news is, your wearable flagged this before it became something worse. The PulseAware app helped us see the early patterns. You're lucky. My father squinted. PulseAware? Dr. Fields smiled. Yes. The system your son built. Silence. Then he looked at me like he didn't know who I was. Not in a bad way. In a new way. He nodded. Just once. It said more than any apology ever could. 2 weeks later, I was back at my parents' house for dinner. Same table, same dishes, same overhead light with the flickering bulb. But everything felt different. My dad carved the roast in silence. Then, without looking up, he said, I read about your app in that Mount Sinai newsletter. You're helping a lot of people. My fork paused mid-air. Thanks, I said quietly. He nodded again, more sure this time. You built something. Something real. Then he added, I was wrong. That's all. No speech. No tears. but it cracked something open in the room. Later that night, my cousin's fiancé, remember him? The one who laughed at my little project? Pulled me aside in the kitchen. My dad's using your app. His doctor said it caught his arrhythmia early. I just wanted to say thank you. I didn't say much. I didn't need to. For years, I was the ghost of wasted potential. Now I was the quiet force behind something that saved lives. Turns out, building in silence doesn't mean you stay invisible. It just means the moment you're seen, they never forget it.